This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, welcome back to the program. Well, Russ McDaid joins me. He's the president and CEO of the Pennsylvania Healthcare Association. He comes in from time to time. We look at a lot of issues, particularly affecting senior citizens in this state, and Russ is the president and CEO of an organization that represents the, what do you tell us?
The Pennsylvania Healthcare Association, representing seniors and those who provide their care.
There you go, in a sentence, much better than I could have done. All right, one of the problems that the health care reform bill that passed the Senate, that's in this United States Senate right now, passed the House, is in the Senate, has to do with Medicaid and the funding of Medicaid, who's eligible, in simple terms. And by the way, it looks like the Senate is going to reinstore some of the funding and some of the mechanisms to get money into the hands of folks who need it. What's your big concern about this? I know that you are, and you have positions on it.
Yeah, Terry, we were just in Washington, D.C. last week, in fact, speaking to both Senators Toomey and Casey about the issue. And our concerns are really, as the population that we care for, as you know, our aging population's growing. The vast majority of them rely on Medicaid, not Medicare, and that's something that most people don't know. We've talked about that before. Yep. Medicaid to provide their care once they exhaust their resources and their money runs out. And each of the proposals, the House proposal, what we all believe will come out of the Senate, falls short of the growth in the Medicaid program that we need to see to meet the needs of our seniors and people with disabilities moving forward.
Yeah, well, as we look at this, it particularly, given what you do, what your members do, how many folks are in nursing homes, would you estimate?
Well, there are 82,000 on a daily basis here in Pennsylvania. That's all.
That's all. Just 82,000 people.
Yeah.
Size of a city.
Well, and about 52,000 of them are paid for by Medicaid.
That's what. Yeah.
That's the piece.
Yeah, that's where I was heading to. So without that Medicaid money, those people either, you all have to do what you have to do to try to help them, or they lose the care. And let's be honest, at some point in life, whether you want to go voluntarily into a facility like yours, or the folks who care for you just simply can't do it because they have employment of their own, this is potentially a big problem. Yeah,
very few people enter a nursing facility voluntarily. It's not like going to a hotel for the weekend. However, we provide a home-like setting and a high quality of care when someone needs to be there. It's usually a life event. It's a health event. It's a fall, it's an injury, or a change where you just can't be cared for in home. Your sons and daughters, grandsons and granddaughters, and you work together and say, we just can't do it anymore.
And as I like to point out, I don't think you can find a family in the state that in one way or another has not been affected by this. I mean, it's that important. And so, in terms of the Pennsylvania budget that's being debated as we speak, what aspect of the Medicaid funding matters for the state? And we can point out that there's a federal-state component, right?
That's right. It's about 50-50 match. So the state puts up $1, the federal government puts up $1. That's why there's a conversation in Congress. Right now, with the Medicaid funding as it is, nursing facilities are still losing over $25 a day for every Medicaid patient they care for. That's why we're so concerned those cuts would even be more drastic and make it more difficult for us to do our jobs and for our staff to do their jobs in caring for residents.
And something to point out, this is just not a problem in rural and small-town Pennsylvania. It's also a problem in urban and suburban. This is a universal problem in this state. This isn't, in some respects, even though it has become a little political, basically constituents of virtually, of 18 members of Congress and 253 members of your nodding state legislature are affected by this, correct?
That's our biggest challenge in Medicaid advocacy. Everybody has a picture of the people that Medicaid covers, and certainly there's a stigma out there that people are quote unquote maybe gaming the system. That couldn't be farther from the truth. The vast majority of the people on Medicaid are there because they've run out of money, because they qualify financially, and because they need it to pay for their care. We've been flat funded 4 out of 6 years in the state budget, and we've got to find a way to do more for our seniors.
So what level of funding are you seeking in Pennsylvania?
Yeah, we've asked for a 2.7% increase, which is, not to get all jargonish, but it's the rate of medical inflation. So that'll help us keep pace with the medical inflation and help us keep pace with the needs of our staff and our residents.
Okay. Now, virtually every day you see commercials on television that do what? That talk about, you know, do you have a problem here? Do you have a problem there in nursing homes? And here's how you go about reconciling. Translation, lawsuit, right?
That's right.
So you have some big, your organization and others are in favor of what they call lawsuit abuse reform. Do I got that right?
That's right. Reforms to the system. It is a mouthful. And you're right. There are ads out there both on television and in newspapers in particular. In fact, over 150 of them since 2011, Terry, that paint a bleak picture, frankly, of the care that's being provided. Those, hey, if your mom's been in a facility and you think something might have occurred, give us a call. We'll get money for you kind of ads. And it's draining money from the system, and it's taking money away from resident care and away from bedside. It's far from what the trial lawyers would sell it as providing protections for people who've been harmed in some way.
Okay, then the follow-up question is, if this is the situation, then what do you want to do about it? What do you want the legislature and the governor to do?
Well, back in 2002, the legislature and the governor at that time realized for our physicians that they were leaving Pennsylvania in droves for some of the same reasons, and they enacted the MCARE Act. One of the things MCARE did was put a limit on punitive damages. And understand that's the bonus number on top of people being made whole after something's happened. So that bonus number, they put a limit on it at 250%, and we're asking for the same thing, a limit of 250% for nursing facilities and assisted living residences above and beyond what that made whole number or the compensatory number is.
Now, what's the prospects? How's this all going? Legislature, and we're going to talk to Gene and Dave about it, got its hand full with a whole variety of things. Is this something imminent? Is it something you're going to wait until the budget's done when they come back in the fall?
Oh, no, it's imminent. We've got our sponsor, and it's House Bill 1037, our sponsor, Representative Warrenkamp from down the southeast. We've been working very closely with him, with the House Judiciary Committee, where we're looking forward and working towards committee action and a vote onto the House floor by the end of this month, and then getting it across the finish line in the House and over to the Senate, so that we can move this onto the governor's desk and start to help our facilities and the people they care for with some of these real reforms that will put dollars back at the bedside.
So in the scheme of things, for in the role you play in senior citizens, you've actually cited what you think are two of the huge issues. One is this 2.7%, I think you say, funding increase. Now, the governor only asked overall for a 1.8% increase in the budget. We'll see how that all goes, but there's lots, at least there are ongoing negotiations. I'll talk to Gene and Dave about that in a minute. But the fact of the matter is that these are your concerns, big concerns, and you think you have a chance to get this all straightened out before they take the June 30 or whenever they get done with the budget, that summer recess.
Yeah, Terry, they both deal with resources. So the lawsuit abuse reform, over $100 million a year, our facilities are paying not to provide care, but to fund our litigation climate in Pennsylvania. We've got a member that pays more in litigation expenses than they pay in food for their residents now because of this. And then, of course, on the budget side, it's Medicaid dollars that can help us do our job more effectively.
All right, look, this is great. You'll come back and keep us updated.